There we go. All right, everyone. We're waiting for the room to populate, so welcome. I was just enjoying the joys of getting technology to work properly, so we're glad you're here. And we'll be getting going in just a couple minutes here again as the room populates.
While we wait, it would be great if everyone could just put in the chat maybe where you're coming from, your organization. Would love to see who is here with us today.
We love our friends at Olympic College.
Right. We're gonna give it a couple more minutes here. I know the little Zoom room population always takes a little extra half second there, but we're glad you're here. We're excited to share the survey information with you, and this is it's always interesting. We're always excited to see. We learn from it every time we do it, and it's great useful information for our clients to use with their donors and their leadership as well. So, with that in mind, I think we'll get going here as we continue to populate. But I always find these are really an opportunity for us to have a robust conversation. So feel free to post questions as we go. We'll try and answer them as we go. I'm one that I have a certain level of impatience, and I want to know the answer to something as soon as I can get at it. But we'll have some discussion at the end, but certainly ask questions as we go, and we'll do our best to monitor and track those as we go. Uh, so with that in mind, as noted, if you have a question, please feel free to use the Q&A feature there to submit your question. Some of these we'll try to answer live, but we'll also be responding to anything via email, hopefully within 24 hours as we go. So just going to make sure we have we got Chapman. We are folks logging in from Canada, so welcome. We're glad you're with us. And with that in mind, we'll do some brief introductions. I'm Mark Marshall. I'm one of the owners here at BWF and Chief Strategy Officer. I oversee our consulting teams, and I get to spend a lot of time with a lot of great institutions, including a lot of great healthcare institutions. With that in mind, I'll let my colleagues introduce themselves. Kara?
Hi, everyone. I am Kara Wagner. I'm an Associate Vice President here at BWF, and I too work almost exclusively with wonderful healthcare clients across the nation. And for me, my area of real focus is with academic medical centers, pediatric organizations, and then I also really have a subspecialty around grateful patients as well. Jan?
Hi, everybody. I'm Jan Wood. I'm the Senior Managing Vice President here at BWF, and I lead the healthcare team, former Chief Development Officer. So I love what you do and the importance of what you do. I have full areas of healthcare, but a specialty in regional health systems, non-academic health systems, community hospitals, and regional medical centers. So excited to be with all of you here today.
Yeah, what's interesting is we work across this broad range of healthcare. It's interesting is that 20 years ago, people would have identified themselves as a children's hospital, an adult hospital, academic medical center. We now have a lot of systems that have all of those combined into one organization. So it's gotten more complex. Doesn't mean the solution isn't equally complex, but it does create an opportunity and the need to kind of be data informed to be able to do things. As a note, so our agenda for today, we're going to walk through a little bit of methodology so you understand how we got the results of the survey, what we're seeing as some of the trends, key findings, and an opportunity for questions and answers. But again, ask your questions and we'll do our best to answer them as we go. Um, all right. So with that in mind, just a little bit, I always feel the need just, a little bit about what we bring to the table as a team. We really try and make sure we bring an array of what's happening across the global philanthropic market. that we're tend to be a very data-driven company. So we're always looking, like the survey, we're looking for information to help guide recommendations in partnership with clients. And then long-term history of the company of really kind of doing first of its kind. And as Jan mentioned, we've got a team that knows healthcare intimately and can bring a lot to the table as part of that discussion. Our commitment is always to help you all be successful. A couple of things, just as Kara mentioned, we spend a lot of time with grateful patients around strategy development, about how do you build a program. Most people already have some form of a program, so how do we get them into alignment? Are they delivering the things you want? The flow of data is extremely challenging in grateful patient activity, just because there's somebody that's you're gonna be an important hospital to them today. You weren't important yesterday, but you're really important today. Prospect management, again, constant flow. Our EDX, our donor engagement team, really focuses on all the ways to engage donors in the ecosystem. And then finally, a lot of the modeling. Who are our best donors to be talking to in the AI segmentation? So all things that are some of the partnerships that we do around this space.
Okay, so as Mark just said, many of the clients that we work with have some varying level of a grateful patient program, and we want to hear from you. What would you say on a scale of 1 to 10? How would you rate your grateful patient efforts? And it's interesting because as Jan and Mark and myself, we go around the country speaking with different clients. And one of my favorite things to talk about is when clients go, we don't have a grateful patient program, or, well, I'm just waiting for this grateful patient program. And the more we talk, we realize there's always something there. We can always improve. And that's where we're here. But there's so many different components. It's how you might gauge their effectiveness. That's where we start getting into a scale. So please go ahead and put in there. I can tell you we've got quite the range coming in. We'll share results here shortly. We've got quite a few in last few seconds here. I will give a sneak peek. I'm just going to tell you that right now, no one has answered that you are a 10 out of 10 program. So you can just say you're all in good company, that there's lots of work and lots of opportunity ahead.
Yeah.
All right, why don't we go ahead? We're going to end the poll. Let's go ahead and release the results here. Okay. Looks like we've got quite a few that will say that there's quite a bit of room for improvement, but we're going to talk about what that can look like, and also talk about how those motivations from our grateful patients. And that's really where we can focus, is if we know how they're motivated, we might know how we want to work with them. Okay, let's move ahead.
All right. Well, I think we can share the results real quick. And with that in mind, we're going to stop sharing the results and we're going to move on here. So great.
Okay, so today we want to talk about the affluent donors who you all work with every day. So we know that most of you are from academic medical centers, hospital systems all around, in all shapes and sizes, which means you all know that the healthcare philanthropy landscape is ever changing. It is at an inflection point in which we know that the shifting care models, just even the political polarization that is happening and playing out every day, we know that is impacting your world. We know that it is do less with, or do more with less. But again, when it comes down to how can we do that, sometimes it's by building strategies that we know are likely to result in the engagement of the right prospect at the right time. And that's what this survey really aims to do, which is understand the motivations, understand why someone may give as either a grateful patient or as a community member. why they may give can really help shape your strategy. So that is why we have conducted this healthcare survey that really looks at the types of donors that you're working with, which is affluent healthcare donors. So to do that, move ahead, Mark.
Yep.
So with this survey, which we conduct every 2 years, and we've been doing so since 2000, so it is now in its 25th year, and we do them every other year so that we can really look at that shifting model. But as the shifts occur in our own landscape, it's also where the shifts occur with our donors, and it really all follows the landscape. Mark and I were just talking, I said, what did you see 25 years ago? And one of his answers was, we talked a lot about technology. We've stopped doing that because if you don't have online giving at this point, you're probably a little behind. So the point is it shifts with the market. And I'll tell you, one of the shifts that we've seen is even in the participants who responded to the survey. So if we're looking at affluent donors, in our survey, that means that they have given they have income of 250,000. So again, affluent versus wealthy, meaning it's in the bank, it's long term. This is affluent, meaning this is our income, and we can also utilize that income in philanthropy. What we saw this year is that the age of the respondents, 39% ages 30 to 44. That is much younger than what we've seen in the past, and it actually ends up following the results, again, in line with that landscape.
Great.
So as the survey, again, for the themes that emerge each year, again, Mark and I wanted to see what did it used to look like and how have you seen those shifts? And it's interesting because even over 25 years, some of these themes have stayed consistent and some have shifted quite a lot. So in this case, I already mentioned, we want you to have online giving, of course, but now it's an intensified and multifaceted use of electronic engagement. And even that is the key word. Engagement, not just a tool that we're using for online gifts. But it's also about the need to ask more questions regarding their passion, because you see the themes that emerged here. Donor engagement and stewardship is so important. If they don't see the impact, they're not going to return as your donor. Technology, we've touched upon that. We want storytelling. This is again where we can be engaged with a donor without even knowing them, because we know the types of stories that are likely to resonate with them, because we know what motivates them and what they find important. We want active listening. And of course, it is always about pipeline solutions. And in this case, again, you see this younger donors are increasingly engaged, just as they were the ones filling out this survey. It's because they care about healthcare and are donating to healthcare.
Yeah, and these are some consistent themes that we see really across the philanthropic ecosystem, right? Is that the intensified electronic engagement, that's how people are consuming information generally, whether they're interacting with Target or planning a vacation somewhere, they're expecting to look at this stuff digitally. They're expecting that piece. Do they still respond to direct mail? Absolutely. But there's an intensive everything from storytelling to all those kind of pieces that are important to people. And so that theme is real, but it's an important piece because there's a tendency that we want to minimize in the healthcare space how much storytelling we do digitally, because we're cautious about what goes to patients, appropriately so, right? But that's one of our challenges because most of our electronic engagement, or think about our websites, they tend to be patient navigation portals, not storytelling locations. And so this is really our opportunity to think about how we think about that and how do we look for opportunities to tell stories. And then we also want to be really looking at donors engaging in a different way of loyalty. They don't support you because that you happen to be their local hospital. They support you because you do good things and they support your mission more so than a physical place. So we've had that change, and that's an important theme that seems to be emerging through the study and to be consistent with what we're seeing elsewhere.
And as we're seeing across the landscape, pipeline challenges and opportunities, right? We're all looking at the base of our pyramid and how are we maintaining and growing donor retention. These younger donors are our donors of now, but also are our major and growing major donors of the future. So this is our signal point that this is our strong base of the pyramid that we want to optimize and grow, not just to achieve our goals for this year, but 5, 10, and 15 years from now.
And sometimes we think about that pyramid almost as an obelisk. And these folks, and this is a good way to transition here, these folks that we're seeing really now step up as donors at this level are the people that the donor pyramid looks more like an obelisk, right? Obelisk is, what the Washington Monument looks like, that we have those peak donors that make such a difference in our giving. And this is a consistent theme. Our team, when we looked at the data, there was the question about donors that give it with capacity to make gifts, and with that kind of income. This is a growing area of wealth. And these are our future principal gift donors as we look down the road. But this is a time to capture them when they're starting to have that meaningful experience. How are we storytelling, being good stewards? I'm always intolerant of declining donor counts. We need to make sure people are having a good donor experience. But these are consistent with what we're seeing. Giving USA saw a 40% increase between 2016 and 2022 of the millennial donors. They give differently, and their behaviors are different than their baby boomer parents. Um, I also wonder if part of their interest in healthcare isn't rising a little bit because they're taking care of those parents, and they're seeing some of the challenges ahead. And those are equally we've seen in some of the work. University of Indiana's Lilly School of Philanthropy did a study and about younger donors and really saw health issues as an increasing amount of interest among that group of people. Again, there's probably some external sources that are impacting this. And I think that's everything from what they're seeing with their parents to apparently we talk about healthcare at the national level if you've missed the news the last several months. But we also have things. I have a history poli-sci degree, which I'm not sure is useful for anything, but I spend time with my genealogy, DNA type things, and people are getting feedback about here's the 4 or 5 things that may be a concern for you in the future. So we have outside sources that are also increasing people's interest in healthcare as a giving opportunity. Some other things here that we asked people to rank where else they're giving. And I thought there was a really interesting observation that my colleague Jan here made about where healthcare causes versus hospitals. Jan, you want to talk about that a little bit?
Sure, I call this the good news, bad news slide. I love the fact that healthcare causes is at the top. That's great. That means what we do matters to them. The challenge is, as these younger donors are less institutionally loyal and less globally mission loyal and are actually more interested in particular programs, particular initiatives, specific impact, they are, as of right now, are seeing that happening in the more specialized either disease charities or in the children's hospitals, cancer centers. When you're a hospital that takes care of all sorts of morbidities and provides all sorts of care, it's our job as the fundraisers to really start to narrow our focus of our storytelling, right? It's no longer about the mission and the vision. That's got to be a part of what we're talking about. But we also have to, with these donors, drill down deeper and listen more and ask more questions because we need to take hospitals and move them up towards the top with healthcare, right? Because even in the healthcare space, there's a lot of competition for these donors.
Yeah, absolutely. And when we looked at this, healthcare causes is preferred at kind of on a 4-to-1 over hospitals and healthcare systems, right? And some of that is the transactional nature of some of what occurs at some of our hospitals. I always look at the changes in everything from when those of us who are of a certain age that when we were born, our mom stayed in the hospital for 3 or 4 days. Where now it's it's a one night and you're heading home. There's other things that you would have gone to the hospital for that now are you're in and out in a day, or you're in and out on an outpatient care. So healthcare is changing, and people's interface with it is changing as well. So we have to think about how we capture those donors most likely to support the institution, from everything from solving problems of society to taking care of our communities. One of the things to think around healthcare causes in our work across the country with principal gift activity, one of the focal points on healthcare causes, I've heard donors say they're willing to give hundreds of millions of dollars because they want to solve a cancer, or they want to solve a particular disease, or they want to change that trajectory. And we see that across the board in other studies that we've seen, that, what's the interface around research versus programs, and how do we deliver that care? And that's just demonstrated in the survey. It offers some challenges and opportunities for all of you as you do your work. A couple other things is one of the spots that I have really struggled with as an industry is when we've kind of normalized the idea of declining donor counts is a trend, and we say, it's okay. It's not okay. It's probably the one single thing that we should make sure we're focused on. And I get it. I don't want to go to my hospital CEO and say, hey, we missed our goal by X number of millions of dollars, but our donor counts is up. I get that, but our donor counts, we should be striving every year to have more donors, and donor recognition is a key part of that. And these are surveys that I think are really challenging when we think about what does recognition mean. Um, there is value in recognizing donors. We actually, as part of our company, we added a donor relations specialist over the last few years to build out that donor engagement piece, because we think it's that important to the future of philanthropy. If we have fewer donors caring about us every year, that should be a real concern for us as entities. So uh, as we think about what those things might be, certainly one of the key pieces we've caught in feasibility style interviews and other survey work is, while people will say they don't want recognition at the same level, they do care about the experience they have. As we think about those grateful patient experiences, to be recognized at the door, to be greeted sometimes by an administrator, to know that their experience, their care should never be different because they're a donor, but sometimes they may feel like they have an elevated experience. And donors care about that. Again, there is some difference based on income levels. Um, Donor recognition by having your name recognized varies a little bit and by person, but certainly donors who are up and coming like to have like to have a certain type of recognition that's different than others. So all things that we should think about as we're building out our donor recognition, and most importantly, our engagement strategies. Jan, Kara, anything you want to add to that?
I think this it tells us that donors don't always completely tell us what they're feeling, right? I think most donors do want to be recognized in different kinds of ways. I think, especially for older donors, there's a humility of I give because I care, I believe in the mission. But at the end of the day, we all want to be recognized for our good work. So I think, again, it causes us to dig deeper and listen more and provide more options and create that safe space to say, you deserve recognition. This is a wonderful gift. How can we do this in a way that really means something to who you are as a person and matters to you and your family? Because I think there's a humility coming through here in initial answers that when we dig deeper, people then get a little concerned if they don't feel they were as recognized as they would have liked to have been.
Yeah, when we get in concierge, the piece that scores low here is concierge programs, right? And I would tell you, having sat with groups of donors at very significant donors, they will say that it's not important to them, but they will also say that the piece that they like the most is that when they have a challenge, they know somebody they can reach out to. So it's important. It's important to prioritize those people because their better experience makes everyone's care better. Yeah. All right. That in mind, we'll move on here. All right.
Right. So there's no aha moment here, right? Our younger donors prefer electronic communication. They're busy, they're multitasking, they've got more likely younger kids who are still at home. And so electronic communication is preferred. However, as Mark said, we have to be really careful about how we do that, that we don't oversaturate, that every time we send something, it has real meaning to it. And in today's market, with AI, donor AI, and everything that we can do, we can really fine tune our electronic communications by constituent type. And so it requires us to not do more necessarily, or not only do more, but do better and be more customized in how we do our electronic communications. However, we all know this is a relationship business, right? We can't let um, electronic communications and electronic engagement be the lazy way out for donor work, right? At the end of the day, we still need to talk to our donors. We need to meet with our donors. We need to engage them in what I call 3D ways. So it's important that we find that balance of, yes, really having a robust electronic engagement program, but really customizing it. There's so many tools that are frankly relatively inexpensive out there. And I look at just the way nurse navigators or care extenders out in the hospital, electronic communications and electronic navigation and engagement is our extender, right? That's our relationship extenders with our donors. And so how are we using them in the most effective way possible, especially when we know these young up and coming donors really appreciate that time of engagement. Karen, you're on mute.
Jan, I think it's also an important point here that the question is the preferred method of solicitation. And I think we all know that most $1 million solicitations are not conducted via email. We know that. I think it's also important to put a little asterisk beside this because we also don't want anyone, to Jan's exact point, we don't want a gift officer to say, look, 38% say that this is how they want to be solicited. This is how we warm our donors. This is how we engage and in between those solicitations, annual giving, so direct mail, all of these different components are important. But when we're talking about that major gift engagement and solicitation, I think it's important just to note the asterisks.
Yeah.
I think that's a great point. And I think, remember, for these younger donors, while they've got school expenses and all these other expenses, they're at the earlier stages of their engagement, right? They may be giving it $1,000 or $5,000 or $10,000 with a potential in 10 years to give you 100,000 or a seven-figure gift. So at this stage, that's how they process giving, but that's not how we build relationships. So what is that balance as we grow these donors?
Yeah, and by the way, as we've done this survey over the 25 years that Kara mentioned, um, fundraising staff always shows up as the least important. So I apologize to all the fundraising staff out there, but you all know you're important to making that happen. You're important to making the connection. I've always thought sometimes when I've worked well with donors, the proof is that they know what I do, but they don't think about me as a gift officer. They think about me as someone who just helps them think about how they engage with the organization, right? The other one that's really important here is by healthcare provider, right? I've done this around grateful patient work since 1992, which is frightening on a personal level at some point, but uh, physicians have always struggled in healthcare providers broadly, nurses, other care workers, And they've always struggled with this. And I always thought as an industry we'd made headway, and I'll see surveys that show physicians, almost 75% worry about a conflict of interest, and another 15% worry about it being ethical. They struggle with it. But we know that because we've all worked with very brilliant physicians who have struggled to want to talk about philanthropy. They know it's important, but they struggle to talk about it. But one of the pieces here when we're talking about healthcare providers is often their role is to be supportive of philanthropy as a concept. When I've done physician training as part of Grateful Patient efforts, I've always talked about physicians when someone reaches out to them and says, "Hey, I got a letter from the foundation," or "So and so called me from the foundation." We don't need the healthcare provider to make the ask. What they're asking that healthcare provider, because they have that personal bond, they're asking for approval. And that if they get that call from a healthcare provider that says, "Hey, somebody from your foundation reached out to me," that we want them to say is, "Hey, that's great. They do important work to support what we do." And so while the percentages say certain things, we know that's based on what the role that they need to play is. So really ask you to think about that as part of your program and what's the right fit based on the type of institution you are. All right. Should we jump on here?
Yeah. So, as we look at what motivates donors, right? That's the most important thing. Interestingly enough, the impact of a disease or illness through research. Obviously, research is why healthcare causes is at the top and hospitals is somewhere in the middle, right? Research continues, and especially in an environment now where we are hearing that research dollars are being cut. There are research organizations smartly that are really ramping up their individual and major donor philanthropy to make up that difference. And they're getting a lot of support in the news of why that's important. And it is important. And frankly, even in most of our community hospitals, we have docs who are doing research and doing great work. So knowing that that is something that really motivates a lot of donors, especially young donors, right? They're bright, they're thoughtful, they're intellectual. How do we look at we may not think of ourselves as we may not be an academic medical center, and yet we've got docs running trial programs either in partnership with an AMC or within our own or in our own hospital and health system. How do we translate that into more stories and more impact for our younger donors? Because it's clearly something that matters to them. As Mark mentioned before, that 40 and 50-year-old groups of donors who responded to our survey, they're taking care of their parents. Their parents are living longer and they are managing the health care. That is changing their perspective on healthcare and the role healthcare plays. And so how do we look at that multi-generational experience in healthcare and translate that into the stories that we're telling? Donors, as we said that they don't like concierge programs, and certainly our medical providers don't necessarily like that concept. We need to reframe what that means. It means creating relationships and creating connectivity with the hospital to help folks out in all aspects of how they engage with the hospital and the health system. So sometimes concierge let's find other ways to talk about it, but that work is incredibly important because most donors will tell you they do appreciate the fact they know somebody and they can call when their primary care doc retires and they need help. It's the foundation that they turn to, and that's an important role that we play. I think the other big shift is, back in the day, even 15, 20 years ago, the 40 and 50-year-old donors, their parents were very capital focused, right? We were building buildings, we were buying linear accelerators. It was all about the stuff. Younger donors, and we see it in other sectors where they're responding to crises and emergencies and things like that. Less interested and worried about things and more worried about our healthcare providers, our workforce development, the programs that we provide, the hands-on care. And so how does that, we're always going to need capital, right? It's part of what we do, but how do we balance those stories? And that's really the benefit. We're seeing more and more comprehensive campaigns. Comprehensive campaigns make a lot of sense because it allows you to tell the full story of healthcare in your community and invite donors to see themselves in that story. Sometimes it's capital, sometimes it's program, sometimes it's people.
And a couple of things to think about here is as we're looking at things like the recency piece. We all know gratitude dissipates quickly. One of the things is take a look at at your patient mix. There are some, when I think about a few programs we've worked with, certainly if people have, if we really bifurcate our prospect pools into two, one is those people who have had traumatic experience. They've had a heart issue or they've had a cancer scare. Um, that's a traumatic experience. But there's a gratitude window that you want to climb through, right? You want to go through that as quickly as you can. But we also have folks that deal with things like cystic fibrosis, that may be dealing with Parkinson's disease. I can think of a place that they disproportionately raised their money around Parkinson's because they knew they were going to be engaging with that organization probably for the next 3 to 5 years of their life as their father or spouse was dealing with Parkinson's disease. So lots of opportunity to really think about how do you align different types of engagement strategies to match your donor pool or your patient pool. And again, the capital projects piece will depend on the type of place you are. Other thoughts, Kara?
Yeah, I think it's really interesting when we think about that chronic versus a critical kind of traumatic moment versus the chronic diseases. Even within each of those areas, you can even get more hyper focused. Example would be within cancer. We know that window is a little bit shorter, period. But now think about the types of cancers and even some of the treatments and their effects. When you start thinking about the difference between, let's say, pancreatic cancer, where that window of time for engagement is much shorter than in some other areas like urological cancers. There are differences even within when we think about the impact on their life, the treatments offered, how their families are affected. This is something that with really sophisticated strategies that can play a role. And again, it's that insight on that right timing and the balance and way that you engage with the patients.
Absolutely. And that gratitude again can dissipate quickly. We did a project with somebody who had made a big commitment and the organization was a little slower to get moving than it wanted to in a project. As we all know, projects don't always move at the pace we'd like them to. And it went back and talked to the family, and the family said, we're still going to make a gift, but it was going to be a quarter of what they had planned to make. And it was because they had moved forward. They had started looking forward towards their life. Had the organization solicited a gift and moved forward quicker, they would have gotten the full gift. They would have gotten, a multi-million-dollar gift. And it was still a very nice gift, but it was a quarter of what it would have been. Gratitude had dissipated. And that's why making sure we move at an appropriate pace really matters.
I think especially for our younger donors, as their lives are very busy, and there are a lot of distractions, that window is even smaller.
Absolutely, absolutely. And the one exception here, by the way, is Jan pointed out that healthcare healthcare causes versus hospitals. One of the uniqueness is I don't know of a children's hospital that I've worked with, and I've worked with, I don't know, 30, 40 of them over the course of my career, or cancer center that hasn't gotten a gift from somebody that they knew nothing about. Right. And often an 8-figure gift. And they're like, we have no idea who these people are. And they made a gift because it was it was that broad universal cause of cancer or children's. Most hospitals don't enjoy that same experience. They will get gifts from people they haven't engaged, but healthcare causes offer some opportunity. And that's one of the values of sometimes leaning into pediatric care if you provide that. Certain fundraising priorities will attract more dollars. Some of health equity is attracting resources from certain peers because they care about their community, and it's not about their outcome. They know that being on one side of town or the other side of town, or from a certain group or another group, means that you have a better life outcome. And those types of broader things can attract dollars beyond your immediate prospect pool, certainly in the corporate and foundation space as well. So things to think about. Every institution has certain opportunities that others don't. So with that in mind, we want to jump onto your questions. So in summary here, so please feel free to put your questions in the chat, and we're going to jump through them. But as we think things here, again, summary, younger donors are important. Give yourself a benchmark of what your donor pool should be growing every year. And younger is a relative term. I say that as getting to be an older guy, but it matters. Acquiring donors matters. Um, Healthcare remains a priority. Everyone's going to need healthcare at some point in their life, and they're seeing sometimes the impact on people they care about, and it's an opportunity. Again, healthcare is outpacing individual hospitals or health systems. People care about where they're going to get care. They're going to care about where their families are going to get care. So there's an opportunity here for you. Thinking about recognition, it matters, and it matters more than most donors admit. And I could tell you 8 million different examples of where people will say one thing, but they actually act a different way. And recognition, whether it's personal or in writing, matters for people. Digital is a must-have. We've done good digital communication with prospective donors, even doing feasibility style interviews. Interviewed a couple that was sitting on a balcony in Mexico during COVID. That wouldn't have happened 10 years ago. It happens today. And then donors are seeking impact beyond bricks and mortar. People know that buildings come down, buildings get remodeled. They want to know that they change the world. All those things matter.
And I think a key takeaway, as we've seen this increased response in our survey just in the last 2 years, and Giving USA saw the same thing, where these younger donors are speaking up and standing up and saying, we give and we want to be we want you to know that we're giving, and we want to be seen. This is a time to look at our 60, 70, and 80-year-old donors and start engaging their adult children, right? What does that generational giving look like? How have we invited them to bring their children who may not even live in the area, but might come home back into town for the holidays, to come out for a tour, to come out and meet the doctor that you love so much, to come out to see the project that you gave to, because we've got to get that. It's not just new young donors moving into our market or accumulating wealth in our market, but in many cases, it's the next generation of our existing donors. And how do we get that multi-generational giving really routinized and really systematized in how we do our work?
Yeah, and again, feel free to put questions in the Q&A section. Great question. Is there a benchmark or best practice average for new donors that organizations should strive for? Kara, Jan, thoughts?
We just did a metrics project for a client of ours, and one of the things that we are actually having them measure now is new prospects, right? So that major giving officer not only has to hit their dollars raised, not only do they have to hit their meetings and their asks and all these, they are expected to bring in this particular case, 10 new prospects every year. And that's part of what they're measured on in their performance metrics. So new prospects is not just the donor pipeline and your operational folks who are responsible for driving pipeline development. We are now seeing more sophisticated and folks who are recognizing they've got to build their pipeline, making that part of a major giving officer's responsibilities, right? So look at that in your market and think about it. If you have, you know, 3 major giving officers who are out there, and you can say, look, you're each responsible for bringing in a new prospect, one a month. you suddenly exponentially start to increase your base of giving and your number of donors.
Yeah, I would just say as a percentage, we do some roadmap things, which are always kind of fun to do, is how do we get to a certain dollar amount over a period of time? How do we build our program? And, I would give yourself, first of all, stop declining trends. Stop declining trends. So many places have declining trends and they explain it away, X, Y, or Z. We need the numbers to be growing, and it's possible. Our teams made it happen several places, but it has to be a priority. It costs money to acquire donors. It takes money to take care of donors, so it needs to be a budgeting priority. But first and foremost, stop the downward trend. And I would tell you, you're probably looking at a number that comfortably you should be able to move your number. Again, if you have an expanding service base, you should be able to be growing it by somewhere between 3 and 7%.
I was
If
gonna say
your if
5%. Yeah.
if your base is flat, like you're not adding new donors to the pool or new community members, that number is probably closer to 3 to 5. But biggest thing, stop the decline. I want to jump to another question here, if we're okay. Kara, do you want to jump in there real quick?
Nope,
Okay.
please keep going.
Have you learned anything about trends specific to mental health fundraising?
Yeah, so we have, and we've seen more and more of our health systems are looking at that as a campaign focus and campaign priority. And as we're doing campaign feasibility studies, it is the campaign priority that sort of across the board resonates. And I don't care what market you're in, I don't care if it's an AMC or a community hospital. If there are priorities around mental health and what we call behavioral health or addiction care, or other types, if your program has a postpartum program, if you have an eating disorders program, these priorities, which I will tell you 15 years ago, people didn't put their name on. It was not a priority. We are seeing across the board, doesn't matter what size hospital or health system you are, what market you're in, that is the one campaign priority that resonates across the board. And it's so prevalent, and it's an area of care um, that people are willing to talk about and invest in and be loud and proud about. That wasn't the case 10 years ago. So capitalize on that, especially young donors. We saw with young donors that was especially an area of interest because they have children who are dealing with all sorts of things.
And Jan, I think to your point of with 10 to 15 years ago, this wasn't a priority that was discussed, let alone a campaign pillar or specific project, period. But now what we're seeing for a shift in recommending is also because so many hospitals are now focusing on mental health, we can't just say that's our differentiator. Look at us, we're different because we're willing to talk about and invest in mental health services. That is no longer enough. It is, again, the storytelling, but it's really why, of course, is going to be important, but what differentiates us, because that's really becoming where the details matter.
And I
Yeah,
would say look at mental health and behavioral health broadly. We just did a feasibility study where hospitals has a really strong forensic nursing program for uh, abuse survivors. And that is an aspect of mental health care. So start to look at how you provide care. And to Kara's point, as you're telling that story, what are specific pockets of real greatness that your care provides that you can focus on with folks?
yeah, I feel a moral obligation to just mention to everybody that, as Jan mentioned, a whole list of mental health recovery has additional restrictions beyond HIPAA, and that requires careful navigation. Happy to cover that. It's really, you think about opt-in, but happy to follow up with anybody who has specific questions about that. I want to jump to a different question here. I know we're close to the end of our time, but according to with findings, what should be adopted by a comprehensive campaign? How would we suggest a comprehensive campaign approach?
I think again, Donors are all different, and they give to different things at different times during their healthcare journey. So at one point, cancer may be a priority and cancer equipment, and later on they have a grandchild who's struggling with mental health issues. So the purpose and the benefit of comprehensive campaign, and it should have workforce issues, right? Do we have nursing shortages, and are we doing nursing scholarships, and are we doing grow within programs, right? How are we funding programs to take patient care techs and grow them into nurses so that we can populate our own nursing population? What are we doing to attract primary care residents to our market? And how are we doing that? We have a lot of markets, especially in rural healthcare, where our staff can't afford to live there. If you are in an affluent but more remote area, we can't find nurses and environmental tech providers and patient care technicians who can afford to live there. So how can philanthropy help support those kinds of programs? So there's the whole workforce piece. There will always be capital. There will always be donors who like things. It's just how that is. And then it's the hands-on patients, right? What are specific programs and or care extenders, nurse navigators, child life specialists? We are seeing very few, even our clients and folks that we talk to who are doing a specific campaign. We're going to do something for our cancer center. It's still a comprehensive campaign. It's got equipment, it's got people, and it's got programs and services.
Yeah, and I would add the biggest key is that our administrators should value everything we raise money for. So while we want to count and encourage all giving to the hospital, health system, or cause, we just want to make sure there are things that our administrators value. Another question in here real quick before we run out of time, and we got probably time for one more question here, I think. Is have we observed any trends in soliciting grateful patients versus letting them self-identify? Are they more likely to donate if approached, or if the avenues to give are readily available? Kara, thoughts?
I do. So this actually goes back to our 2023 survey, and we've continued to see these numbers hold steady. In 2023, we actually looked very closely at not only did you give, but were you asked within a certain time frame from an encounter? And what we found is not only did the patients give, but those who did not get solicited actually gave less a less percentage, yes. But what we found is they still had to do the legwork, that it became harder for them, and they still did the legwork. That why would we not want this to be something that is the very first part of their donor journey, where we're already providing a service? And we say all the time, when we speak with grateful patients, this is an invitation to be a part of something. This is an invitation to pay it forward, to do something for a patient who hasn't even walked through the doors yet, but is about to experience something similar than that the patient went through themselves. Why would we not provide them with that invitation in the most donor-centric way possible? So
And remember,
absolutely.
and remember, when we're talking about soliciting or reaching out to a grateful patient versus self-identify, there are many ways to do that aren't necessarily starting with a call, right? How do we put thank you cards in a patient's room or in a care space or in a care waiting room where patients can write a note to their favorite caregiver, can say thank you to their doctor? That's a way for them to self-identify without picking up the phone and calling the foundation. So what are we doing, to Kara's point, to make it easier for them to say thank you and to raise their hand?
100%. And that's, and there's the strategy around grateful patient about what's proactive, what's a kiosk activity that lets people self-identify. If you're a children's hospital or cancer center, you're often interested in engaging their friends and family, or grandparents. And grandparents don't show up on our patient census, right? So these are about building programs that align with the type of opportunity and challenges that you have. Thank you for those of you who already jumped into the poll. There's an opportunity to kind of look for different opportunities to learn more about things. Thank you, by the way, Kara, Jan. Any of us are happy to reach out to you. Feel free to continue to answer the poll here. I'm going to share a couple of things we have coming up. My colleague Josh Burkholz will be doing the 2025 year in review, 2026 trends scheduled in January. It's always great. Josh is a great big thinker around philanthropy. One of my joys of my career is spending the last however many years with Josh, and it's always interesting to kind of think of what's happening. So hope you'll mark that your calendar for that. Um, and then there's an opportunity. We're happy to send it to you as well, but you can download the full report. There's a lot more information in the report over the course of the next several months, or we'll be doing some additional kind of cuts from the data. There's a lot of interesting data there. And we really appreciated you all taking the time to spend with us. Again, feel free to send any of us an individual email. But thank you for your time, Jan, Kara.
Have a great fourth quarter. Now is the time to raise great money. So best of luck in your fourth quarter.
Thank you all for joining us today.
Yeah, you do important work. Thank you.
Thank you. Bye-bye.